A dire warning today from hospitals. We could be overwhelmed. Ontario Health is warning hospitals have got to be ready to activate surge capacity plans because COVID cases are climbing so quickly. Ontario logged more than 2,000 cases for a second day in a row. And that province also surpassed 4,000 deaths related to the virus. Are hospitals there, and maybe in other provinces, on the brink of being overwhelmed? We begin our coverage today with Dr. Simpson. He is the incoming Executive Vice President of Medical at Ontario Health. First of all, Dr. Simpson, thanks for taking the time out of your incredibly busy day, and we thank you and your frontline workers for the situation. I think there's a lot of hope out there now, which is great, but the picture you're painting on the front lines is pretty dire. Are hospitals at the brink?
Well, I have to start by saying, Evan, I think that we all knew Wave 2 was coming back in the summer when we started planning for this scenario. And furthermore, we knew it was going to be very asymmetrical. So in Ontario, we're seeing areas like Peel and Toronto and York and Windsor and Durham are being hit particularly hard right now, whereas Ottawa had an early surge and they sort of got a little bit better. The north is relatively protected. So it really depends on where you are. But for those really tough hit areas, we know that what happens in hospitals generally follows the kind of prevalence of disease we're seeing in the community. So a few weeks ago, when we started to see those numbers go up, and they're still going up in many areas, it was entirely predictable, I would say, that we would start to see increasing numbers of COVID patients in hospitals, increasing numbers of COVID patients in ICU beds. So we're at the point now where we're asking some of those hotspots, the hospitals in those hotspots, to start formally reserving 10 to 15% of their capacity for a COVID surge.
So yeah, and I think you're 100% right when you say it's asymmetric. But the hotspots are hot, and try to translate when you guys say, "Hey, reserve 15% capacity for a surge." What does that mean to the layperson here? Those of us who don't wear the gowns as you're wearing and are not in the ICUs. What kind of warning level is that? Is that a bad sign?
Well, what it means is that we have to start being really creative. And of course, we're used to being very creative in Canadian healthcare. So creating capacity might mean actually using physical space differently. So physically more beds, growing the denominator. And there are lots of creative ways to do that. It might mean increasing throughput. So patients that are on their way to complex continuing care or to a rehab facility, we accelerate that kind of patient flow. And then the other way to do it, of course, is to hit the dimmer switch on some deferrable procedures and surgeries and defer that care so that we can free up capacity. So every hospital will have a slightly different variation of those things to get that extra capacity in the short term.
And by the way, folks waiting for surgery are already experiencing long wait times. Is this a sign that in some hotspots, we've got the holidays coming up, that you're expecting a spike in January, that for all the hope, we're not even close to being out of the woods here?
No, I think the vaccine announcement was a real turning point, and it allows us to kind of have our eye on the end game now. But we also can't take our eye off the ball. We're in for a tough few months. I think public health measures are going to still be very, very important to protect hospitals from having to do what we're going to have to do over the next little while. But at the same time, I think we learned a lot from Wave 1. We're very determined that we're not going to leave any capacity on the table. So there will be unprecedented cooperation between hospitals to share the burden so that we can keep the regular business of healthcare going as much as possible and not have the wholesale scaling down of elective care like we did back in Wave 1.
Well, Dr. Simpson, we just hope this wave subsides, but I know it's not, and hospitals they're not slowing down. It's going to be a busy, busy season. We thank you and your colleagues for working on the front lines. Dr. Simpson, I appreciate the warning. Thanks so much.